Welcome, everyone, to Overtime with Coach Blue and Athletic Director Marissa.
Yes.
It's so funny. I've erased that in so many places, and I still say it. It's like just rolls off the tongue. I mean, we've been doing it since 2020, so.
Well, how long have we been doing? Did we rename it?
Uh,
Overtime.
I think about it 6-7 months ago, but yeah.
I bet it's been more than a year.
Probably. Time kind of stands still, but actually it's kind of funny to think about. We've been doing our live call-in show now since 2020.
Yeah.
That's crazy.
It's been
Dedication, right?
Yeah, we're almost coming up on 40. Has it really been 4 years?
I know. I didn't realize that until I said that. Like, that's kind of wild. But
Yeah.
anyway, welcome everybody. It's good to have you here. This is our weekly call-in show where we answer questions from you, whether it be but through the DM messaging board, or whether it's an email or passing notes in meetings, whatever. This is a time for you to kind of get your questions answered, and we've got a couple good ones today. And well, we've got a good topic today too that we're going to discuss. That I really was kind of curious about how to present this, simply because I'm like, there's so much change happening in the world of addiction recovery. I have some of my own personal views on some of the stuff we'll be discussing today. But then it's like the whole reason Team Addict II Athlete exists was kind of to change the perception on the way that people perceive addiction and people
And addicts.
Yeah.
Trying to work on some stigma.
And it's interesting because there's a lot of different terminology we're going to be discussing today, but kind of a cool topic.
If you are interested in becoming a Patreon, please check out patreon.com/Addict II Athlete and find a tier that works for you.
Yeah, absolutely. $2 a month. You get all the basics. You get all the bonus content.
Yep.
And so I'm just about ready to record the next episode of Understanding the Inner Child. We've had a good podcast to the Patreon platform. This is how to help it heal. So it'll be a good one for the Patreon subscribers.
There's quite a few bonus episodes, so log on, become a Patreon, and you can check them all out.
So let's jump into today's topic too, because this is an interesting one. Before we started hitting record, I told Marissa, I'm like, I don't know how to present this, because we have so much change going on in the world with what you can say, what you shouldn't say, things that could be offensive to someone that someone else uses in their daily vocabulary. But it's worth getting it out there, because there has got to be some change and there's got to be some understanding as to why. Yeah. It's like this, when we first started Addict II Athlete, the reason why I really wanted to push a different kind of perspective was that I was done calling people addicts. I felt as though it's a negative label. And although I understand the principles behind why we do that, obviously you have to understand that you have a problem so that you can move forward from that. Mm-hmm. But I didn't like the fact that it came after an I am. So introducing myself as, hello, I'm Blue and I am an addict, that is a negative connotation.
Yeah. And no matter how long you're in recovery, that many groups out there continue to call themselves or have people identify as an ongoing addict.
So I haven't used a substance, drug, or alcohol since 1996.
It's coming up.
It's in February. It's just a few days, I think. I don't even know what
Friday.
It is. Friday? It's Friday. I don't even keep track. There's no way I would identify myself as an addict anymore. Now, I'm not dumb enough to say that it's completely gone, because there's still aspects of that inside, but I am so much more than that now.
But guess what? Everybody has those. Yeah. I've never struggled with a substance use disorder, but I have addictive tendencies. Right. Everyone does. It doesn't mean I need to identify as an addict and call myself an addict for.
I get it, and I know that it does kind of sting a little bit with some people. But again, Addict II Athlete is just another pathway. There's many others. I do respect programs that utilize those principles, because they're tried and true. And so for me, I wanted to relabel that. It's a part of us. It's not who we are. Mm-hmm. Meaning that we are. We also build on that. We're athletes. We're artists. We're parents. We're siblings. We're employees. We're leaders. We're all these other things. And
which is
in there.
Part of the symbolism of our name, the addict, Roman numeral II, athlete. Do you want to explain that?
Yeah, so we did that with an understanding and purpose, as we were looking at the name Addict II Athlete. We didn't want to just make it, number 2 or the word 2, T-O, or whatever. Because the Roman numeral system, kind of genius, the Roman numeral system does not identify 0, okay? So if you look at a pillar system, right, when you look at the Roman numeral 1, it's a pillar. It's one pillar, right?
Yep.
And then when you add something to that and 1 becomes 2, it's 2 pillars. You can build on top of the Roman numeral 2.
Yep.
It's built that way. And so we looked at that as we're adding something new to you. Once you have increased by 1, now you have the foundation to build.
Yep.
And that's why we do it. It's a symbol of, again, adding to the narrative. You're no longer an addict.
Yeah.
Now you're an athlete. So you're addict to athlete. So we're leaving it behind. And I really do think that when we understand some of the principles behind the terminology, I think we really truly can change our outcome.
Yeah.
Right?
We start changing that perspective, the shift in thinking, and which usually starts shifting our behaviors.
Yeah. And so, again, I understand that principle, but when we looked at renaming things, there's been a lot of change in language on how to identify certain things in an addiction recovery mindset.
Yeah.
And, things as simple as, overdose, right? Died from an overdose. We're changing that. And the reason why is because there's ramifications and stigma that are attached to these things. And trust me, you're not going to get canceled because you're still using old terminology.
Yeah.
But we want you to become more aware as to why.
Yeah.
As to why there needs to be a shift in the way that we see these things. It's kind of like the process of understanding like an MAT, like program, meaning like a medication-assisted therapy. People didn't like that when it first came online.
Yeah.
And once you start to understand the significance and the reasons behind it, you start seeing the bigger pictures of like, oh, wait a minute, there is value here.
Yeah.
So just like that learning building blocks, we're going to go through a few terms and some terminology to kind of change the perception as to why it's important to increase our vocabulary.
Yeah. And that's part of our mission. It was at the very beginning, like Blue said, is to be able to reduce the stigma, to try to bring about new thinking and change so that some of the negative and unfair beliefs that society has on a group of people can be shifted. And I think it's come a long way, but we still have a long ways to go. So what we're going to start with is to teach some new terms that you guys can use, start listening for, start trying to practice. Like Blue said, I'm going to mess up using them sometimes too. And sometimes I use them old terms because I know no one else knows what the new terms are and they'd be confused. So
yes, that means that when you use the old terms, guys, gals, don't worry. Again, you're not going to get phone calls from someone to your boss by saying, hey, they're using the wrong term or whatever. Like, we're not canceling anything, but we're just saying, like, let's start leading that change and that mindset of like why we're changing these even in the first place.
Yep. So the first issue is...
hold up real quick.
Yeah.
I just saw on there that you wanted to make note of a stigma. What the flip is a stigma? Because this is the thing too. I mean, it sounds dumb and elementary, but like, what is a stigma? Yeah.
So it's a mark of disgrace associated with a particular circumstance, quality, person, group of people. It's a set of negative and unfair beliefs.
See, so when we look at the word addict, it was made and developed and understood as something that's negative. And I can get being okay with that. You have to be in order to move forward, but not as the who you are mindset. So let's jump into this.
So we want to first start with what is called person-centered. So the focus is on the person, not the behavior.
Right.
From my understanding, this started in early 80s. Like, it's been a long time. So what are we at? 40 plus years. My mom was a special educator, worked with people that had disabilities for our entire lives. And I remember her teaching us this. In fact, we as a family learned some of this person-centered stuff and would go around to schools and adult groups and teach about language and reducing stigma for talking about people with disabilities.
Yeah.
So instead of talking about this person, has Down syndrome, or this person with Down syndrome, or that, well, I guess I'm ahead of it, I guess. That Down syndrome girl, you don't say that. You say the girl with Down syndrome, or you just say the girl. Like, you don't even need to associate with the disability. The focus isn't on the disability. The focus isn't on something that's a negative stigma. So instead of the addict, you say the person with a substance use disorder.
Yeah.
So,
but that's kind of breathy, isn't it? Right?
Yeah.
But there's a form of respect there.
Absolutely.
Understanding.
Because the point is the focus is on the person that they have a problem rather than they are the problem.
And Dr. Paul talks about this too quite a bit, about us naming things and labeling things, right? We do this all the time. We do this with our children, like, oh, yep, that's my challenging one, right?
Yeah.
There's my challenging kid. And when that kid hears that he becomes the challenging one, what happens? They rise to that occasion.
Right, yep. They work that in, whether that's subconsciously, whether that's consciously, they become what we identify them as. And we believe fully that's what each of us do. You know, think about you growing up. What were you defined as by parents?
What's funny about that is, I'd never really, never really considered it, but my mother used to always call me the caboose. And the caboose is kind of the last one, right? And he's kind of forgotten. And that's exactly kind of how I felt too. Does that make sense? Like the last, the forgotten, wave to him as he goes by. Like that's kind of a crazy thing. I never thought about that.
Yeah.
But yeah, it's true. So that's why it's important for us to understand that with these things come labels. So instead of that, the addict, it's that person with the substance use disorder.
Yep.
And so, yeah, but it goes deeper into this, right?
So instead of using addict or user, you use a person with opiate addiction or opiate use disorder. Instead of substance abuser, drug abuser, you can use patient, client. It depends on, I guess, the setting that you're in.
Right.
You don't use the word junkie. You may say a person in active use.
Do people ever use that anymore? Or is that just like an 80s term for movies?
Probably an old term, but there's other old disgusting terms that I probably am not going
We're
to
not going to go there. Yeah, absolutely.
on here. In fact, I remember you talking about a group years ago where wasn't it one of the staff called a client?
Oh my gosh. Oh my gosh. I'm so glad you
inappropriate.
Yeah. It was a youth, right? We were doing youth treatment. Treatment. No, this is what made me so bizarre. I'm like, where did that come from? And it was an outpatient program I was working at the time. And one of the staff called one of the young women that was going there a puddle, then SL dash dash. And I'm like,
oh my gosh,
what did you just say? And we had to pull her aside and be like, no. Like, because I mean, even though she was trying to connect with this person, like that is the absolute wrong way and extremely disrespectful.
So degrading, so dehumanizing. And that's what changing some of these terms is really about. It's about focusing on the person and the good things about them.
Yeah, it's funny you remember that. That made me so mad when
I've never forgot it because I was like, how in the world can a staff, an adult to, oh my
Yeah, and I know that, again, that she didn't intend it to be harmful, but it is. And it's disgusting, really.
It's absolutely disgusting. Yeah. So that's a lot of these. You know, we don't use the word alcoholic. You use person with alcohol use disorder or person who struggles with alcohol, person who has difficulty regulating alcohol, whatever, but not an alcoholic, or even a former addict. You could say person in recovery, person in long-term recovery. We don't even use either of those terms.
Funny, yeah, recovery. Right? Like here's a funny thing too, and again, this is just my perception, but I don't even like the term long-term recovery.
Yeah,
because that makes it sound as though there is no end. You know, again, the last time I used anything was in 1996. Okay, I'm not in recovery anymore.
Yeah,
like I'm done. And I look at recovery as being this thing where there's always something broken. Like it's never going to be whole again. It's like, maybe you're playing high school football, you break a rib or your arm, right? Yeah. 20, 30 years later, when your son now wants to go out there and have a catch in the backyard, are you going to say to him, oh, I'm sorry, son, my arm is in recovery from a broken bone I had when I was a junior in high school. I got to be careful. No, you've recovered, you've healed. And I know that's a scary term for some people because when you say I'm in long-term recovery, there's always that little gap in that back door that's just ever so slightly open for just in case moment, in case I relapse.
Yeah.
And again, to each their own.
Yeah.
But for me, I look at recovery being a temporary experience, but eventually we have to heal and move on.
Yeah.
Does that make sense?
Yeah. And even if you look at what happens when you break a bone, your body knows where that break is. First off, it's going to send pain reliever. It's going to send, so that you don't feel it. You have that adrenaline and endorphins, but then it's going to flood that area with nutrients and whatever it needs to promote healing, right?
And
The healing
and promote it does.
and yeah, and the healing progress, it happens immediately and it starts happening quickly. In fact, if you don't get your broken bone into a brace and set right, they have to re-break it because it starts healing that quickly.
And at the point of break, the point of fracture, it's stronger.
Yep.
Think about that as a principle, right? The point of break, when it heals, it becomes stronger. What if we could do that on an emotional and mental level, right?
Yeah.
What if we could really go to the source of the pain? This is why I believe that addiction is kind of an interesting dilemma that we face within circumstances. And that's, what if I went to the source cause of my addiction, the thing that broke, right? Maybe it's that abandonment. Maybe it's neglect.
Yeah.
What if I went there and I repaired that and I fixed that and I dismissed it, by dealing with it, by understanding it, by holding myself accountable, and by either allowing people in or excusing people out.
Yeah.
And what if it got stronger because of that?
Yeah. Isn't
right?
that such a different view than saying, once an addict, always an addict, or
geez.
I have this disorder, I have this disease that I will be fighting for the rest of my life, that you look at it as I'm healing and I've healed and I've become stronger and moving on. In fact, like I said, we don't even, within Addict II Athlete, we don't even use the term person in long-term recovery. We just call them something totally different. Athletes. Champions, participants.
Call them by their name.
We don't even focus on or talk about the addiction.
Last night in our meeting, we talked about, we have a recovery playbook on Team Addict II Athlete, and we talked about the name on your jersey and what it means, the names that we give ourselves, and how we need to live up to that, right? And as we were talking about that specifically, we were talking about the perception of climbing out of your addiction and becoming something much greater than. We talked about Cliff Young, who was a 61-year-old man who signed up for a 544-mile race through Australia and showed up in his work boots and trench coat. And lo and behold, that man won that race. And it's a beautiful story.
Amazing story.
But the coolest part about that is, we don't use long-term recovery. We call it by name. So they were this guy, a farmer and a nobody, and he ended up winning this ultra marathon.
Yep.
And so
he came in, there were other runners that had sponsors and, ASICS and Nike, and he just showed up.
Absolutely. So that's why these things are critical, and that's why they're important.
Yeah, so important. So instead of even using the term habit, we can use drug addiction, substance use disorder. Instead of abuse, we just say use or misuse. Yeah, abuse has an extremely high negative stigma and judgment. So let's get away from that so people can be looked at as people rather than behaviors. Yeah. Instead of some of the new stuff is medication assisted treatment, MAT. They're even asking for that to be looked at differently instead, or something instead of MAT, it's addiction medication or what is that? Pharmacotherapy. I'm not going to say that.
Well, we can't say that. Yeah, that's a tongue twister.
Opioid agonist therapy, medication for a substance use disorder, medication for opioid use disorder instead of opioid replacement therapy. That was really bad. We start focusing on something different.
Well, when you look at that abuse too, right? Like there's these situational things, and most people will try to get a person in recovery into one of two camps. Either A, you have the disease of addiction, right? Or B, you abuse it, right? And it's a choice. It's your choice to be using this. And I don't think you really need to be in a camp on either side of that, right?
Yeah.
But what I've seen in the last 23 years of being a mental health therapist and addictions counselor is that there are a lot less people, and this won't be very, very, popular. But there are less people than we think that have the actual disease of addiction than do abuse the substance.
Or misuse the substance.
And misuse it. Yeah, misuse the substance. And let me tell you why. There's been one person that I know that I would say has the disease, that I unabashedly, I know he had the disease.
Yeah.
And it was such that no matter how much treatment, how much therapy, how much time, how much restriction was placed on him, he would continue to drink.
Even though he wanted to stop. There were many times
he wanted to.
He didn't like it.
I picked him up at the hospital to take him home. I, consulted him with his roommates, and
when he was homeless.
Yeah, and he ended up passing away. In fact, I think when I kind of came online with him, he had the most arrests in Utah County. And you guys, there were tons. And that wasn't a choice. That was the disease.
When he was in the hospital, he would do anything he could to find hand sanitizer to drink it because he couldn't stop, like literally.
The thing is we don't see as many people that have the disease in treatment programs because they never last. Those are the ones that leave. Those are the ones that get out of there. And it's heartbreaking.
Oftentimes they don't even enter treatment because they don't want to. They don't even want to be without the substance.
No. And so what we see more often than not are the people that abuse it because they're trying to suppress some kind of feeling or emotion, right? And we look at that and we call it a disease because, again, it fits a model, but I also think it's doing them a disservice.
Yeah.
And so it's a complicated issue, and I think both are very real, but I think that we see people that are in the abuse cycle far more than we do someone that has an actual disease. Does that make sense?
Yeah. And the ones that are misusing the substance, even if you're talking about also even prescriptions, it's just using outside of the written use for it.
Yeah.
And it's the misuse of it.
But that's the thing too, is when we get into that mindset, we scare ourselves as well, right? We talked about this a week or two ago with Lisa when she was talking about going in to have dental surgery and the medications that she'd have to be prescribed. Well, if we could scare her into trying to suffer through pain, or we could say, hey, let's create a good home team, let's get you some support and use it as it's intended. And I know that's scary for some people.
Yeah.
But there's also that line of if you get in too much pain, you might do something out of the box.
Really
so
reckless.
Absolutely.
And so having a plan that, yes, medication is there for a purpose and a reason. And there may be times that it's needed, but just have a safety plan of sorts and a team that can help you.
Absolutely. What else do you have there?
All right. So instead of the word clean or dirty, it's testing negative or testing positive.
See, that's an interesting one too, because you think, well, hey, I'm clean, right? That's, again, it does kind of draw a line there, doesn't it? Or you're dirty.
Yeah, dirties are such a negative, stigmatizing word.
Well, yeah, the dirty. Come on.
Right, yeah.
I gotcha.
Yeah, it's awful. So you can say, I'm not drinking or taking drugs. I'm abstaining from drug use. I tested negative. I'm not currently or actively using or currently or actively misusing. When somebody is, quote, dirty, it's testing positive for a substance or a person who has used substances or actively using or misusing. Don't use.
I think of this in terms of because I've sat through many treatment teams. When you're in a therapeutic environment and you're a therapist, you have this thing called a treatment team. And the treatment team consists of you, maybe another therapist, maybe some case managers, maybe some peer mentors, maybe a doctor. It's kind of everybody that is involved in your life while you're in said treatment. And the treatment team is kind of interesting because you'll hear some of the people that are at their wits' end using some of the terms and terminology that's a little more rough, right? But even you saying something like dirty versus testing negative or testing positive, that's kind of an interesting thing because what it does is it takes this might sound funny, but it takes the human part away and puts in the behavior, which is exactly what it is. It's not this person is dirty and wrong
or clean.
They're testing positive.
Yeah, and that's outside of them. It's the test. It's, you know what I mean?
Which flips the script too, because if you think about it, testing positive, that usually means a good thing.
Yeah.
Right? And testing negative, kind of a bad thing. But the cool thing is those scripts are flipped at this. And so what you're doing is you're separating the behavior from the person, which is exactly what we need to be doing.
And that's a comment Dustin just said. Using new terms helps clients understand that they aren't stuck in the category or label.
Oh, 100%.
So not only is it for people outside and family, friends, employees, of treatment or whatever, but the person themselves, to give them hope that that's not who or what they are,
Yeah.
is huge. And so many in, are even looking to stop using or early in recovery, that gives them hope, that gives them light
Yeah.
somewhere,
Yeah.
right? And to be able to change some of that. Addicted baby. Instead, a baby born to a mother who used drugs while pregnant, or baby with signs of withdrawal from parental drug exposure, or baby with neonatal opioid withdrawal, newborn exposed to substances.
Yeah.
Don't call a baby
drug baby. That's why I have a hard time with what we're seeing right now too, and it's a term that I absolutely hate, but one that I hope we get to translate to the state when we get to speak to them this Friday, and that is this situation that I'm seeing that is kind of going under the radar with so many people, and we're not prepared for it. If we thought the opiate epidemic was a big issue, and the fentanyl issues going on right now. Lord have mercy when you see what's coming next with this unexpected wave, and that is the term that they've labeled these kids who have lost a biological primary caregiver and now are being raised by non-custodial parents, even if it's grandparents or whatnot.
Yeah.
The potential for them to have these huge emotional and mental impairments are what they're calling and terminating the opiate orphans, which I think is gut-wrenching, and we got to come up with a better name for that. But I'm seeing them now. And these quote unquote, kids who have lost parents, they are now turning 18, 19, and 20. And all of their parents passed away when they were young. And so now they're coming into this world of like, who really cares about me? Who loves me? How do I know how to love? How do I know how to be loved?
Yeah.
Because
just knowing who they are and having that connection, even if they're being cared for by family members, they're being put into some kind of foster care with family or grandparents. Like, there is an issue when biological first generation parents aren't with a child.
Absolutely. So it's a gut-wrenching term, one that we're seeing a lot of, but we do need to come up with a better label than that.
Yeah, for sure. Overdose prevention sites. Instead, we say safe consumption sites.
So, and there was a terminology too about even describing someone that's had an overdose, right? Instead of saying he OD'd. I've heard of my clients being treated differently once they've disclosed to medical professionals that they have some of these history of these issues, despite the fact that maybe they have a significant amount of clean time. If they utilize terminology that indicates that they are that, then they will be treated as such.
Or even that they have struggled with substance misuse in the past. Yeah. I think medical professionals are doing much better. But again, it's the stigma that they were raised with. They were even taught that we're trying to change to help them be more open and understanding and empathetic, to everyone. And their plight.
And I guess, if we're talking about all things, terminology related, I think we got to also broaden the perception of all this and even start to understand, situational issues of people with mental health disorders, right?
Yep.
And, it was interesting. I think it was a year or two ago, we were in Las Vegas for spring break. We were down there to timeshare with your dad. And we got onto this elevator, and this kid just started the most heinous racial slurs. And I got my shock, and there was a few other people in there, and as they were pulling this kid off the elevator, I think his mom or his dad said he's autistic or had some kind of member, and I'm like, ooh, geez, that's scary. Do we have a certain tolerance for this? Marissa and I were talking about this specifically too. I don't know what we were watching, but it was you were watching Love on the Spectrum.
Oh, such a good show.
Yeah, and it's about these young men and women who are on the spectrum, and them trying to build relationships. And I was talking to Marissa about, do we see more of this now? And she said, no, it's always been around. And it was funny because as I started to dissect relationships and people that I would consider like, now knowing what that looks like on a clinical level, and as I was trying to explain to you, like the reasons why this person was, was mean or rude or was considered a bully, when we started breaking down the behaviors, I'm like, wait a minute, it sounds like that person was probably on the spectrum.
Yep.
And here's me as a youth not understanding those behaviors, And so I'm looking at it as mocking, like bullying, when really it was probably just the way that individual perceived the relationship or the situation. Does that make sense?
Yeah.
And it kind of gave me that Maury Povich and Barry Springer where I'm like, they come out and confront, right? And I'm like, man, there's so many situations like that where you're even in public and someone does something wacky or stupid and you're just like, upset in arms. Take a little bit of a step back because there may be a different issue. Yeah. So how do we get cool with that, right? How do we just let that stuff
you have to
happen?
let it go.
Gotta let it go.
We have to understand that everyone's got something. And even each one of us. And so, we are also not our disabilities either.
No.
Right? Everyone's got something that keeps them from being perfect.
Well,
so.
One of the funny things about Coach Blue here is that, and I don't tell too many people this, but now I'll be on podcast forever. I think we talked about it before. I'm blue-green colorblind, which is kind of a funny thing, right? And so I don't walk around, hello, I'm blue and I'm colorblind. Like, you know what I'm saying? Like, it's part of me. It's not who I am.
Absolutely.
Right?
Yep.
In fact, I actually learned more about my colorblindness, which is hilarious, but it's a whole nother podcast. But
I'm Marissa and I'm nearsighted. Do I need to say that?
No.
Until I get corrected vision surgery? No.
Yeah. And you know what's funny about that too is even the labels that we give ourselves, like I didn't think that I was academically inclined and still kind of feel that way. But I have a master's degree. And it's kind of a funny thing. I'm like, these labels that we put on ourselves would limit us if we allow it to.
Yeah. If that's where the focus is, obviously we need to learn and understand it. Like if I didn't ever pay attention to my eyesight and issues, I'd be in trouble.
Yeah.
Absolutely. Yeah. Like I got glasses in 6th grade. I'm a little shocked none of our kids do because you have glasses or contacts now too. But if you're not aware of the disability or something that's holding you back, you can't get better, but that's not my focus. I've got glasses, I got contacts, and I move on.
Well, when you look at it this way too, it's kind of an interesting thing. So there was a funny situation that happened to me when I was going to college. And I was going to college. I was supposed to be the class of '94. I ended up being the class of 2000. Had a little break there, right?
Years.
I thought school was for dummies, and so checked myself out. When I was dating you, Marissa, there were some things that I needed to take care of, and finishing school was one. So I went back to adult high school, got my diploma, and then you suckered me into going to college. And I'm like, I don't go to college. What's that, right? So much so that Marissa not only had to help register me for classes, but she had to walk me around the campus so I could see where the flip I was going.
Walk him to class,
and
buy the books.
Again, I'd always had this mindset as though like I'm dumb. I couldn't do math good. I stink at spelling. But I started going to school and lo and behold, I kind of started to enjoy it. But math, oh my gosh, math was the bane of my existence.
Yeah.
And so, I tested 2 degrees below even getting credit. So I started at Math 95, which was 1 + 1 is 2, right?
I don't know if it's
even I'm mocking myself.
Yeah.
It's high school stuff. And by the grace of Almighty, I passed that. And then
I don't know how you did.
I don't either. C-. I did that.
Oh.
Then I went to Math 99.
Which is still not college.
The very first day of Math 99, they covered the entire year of Math 95. And I'm like, I'm screwed. And I tried and I failed and I tried and I failed. And
then it got really expensive.
I got put on academic probation.
Wondering.
But I was doing fantastic in other classes, but math, right?
You were just moving on, getting closer and closer to that bachelor's degree. But
so Marissa says, well, let's not take math for a bit. And I accelerated. Well, I go and get tested. Your mom. She worked with
special
ed, and Coach Blue was very much a special ed kid, and got me in touch with a psychologist. I got tested, and lo and behold, with all these experiences, guess what? I have a math learning disability.
Yeah.
That it's not my fault I can't do math good. It's a disability.
Yeah.
So I had to go waddling into the old accessibility center at the at
limitations.
UVU. And I go walking in there, and I'm seeing people in there with disabilities, blind and deaf, and
some physical disabilities. Yeah.
And I'm walking in there feeling like an able-bodied person, and like, I can't do math good. What services can you give me? And I did feel really like out of place, right? And I got connected with an amazing person that was helping me. And they did some cool stuff. They taught me, they told me, go to the learning lab and go to the tutoring lab, and we'll give you longer test times, and we'll give you a calculator. And all those things were great.
And some of them helped.
But nothing really took. And so here's what happened, right? I go to the very first day, I go to the study hall lab to have these people come help me. And so I'm stuck on a problem. This kid who is much younger than me rolls over, cranks his problem out, and then walks away. I'm like, oh, okay.
But what did you do?
Yeah, how did you do that? There's a kid history video about math that I feel like, it's a whole nother story.
Your whole life.
And I go to tutoring and I do all this stuff, and I'm sitting in tests longer, and I've got calculators, but I don't know how to put these numbers in. Math learning disability. I'm getting closer and closer to graduating. And finally, the last thing that my counselor says is like, the only way that we're going to be able to get you out of math is if the dean lets you out. So you have to write him a letter. And I think she said that kind of out of like, good luck.
Yeah.
And so I did. I wrote the letter to the dean of the college explaining my situation, showing him everything I've done. Because I didn't, this is the nutshell version of this, right?
Yeah.
I literally had to explain to them everything I'd done and how something's wrong. And lo and behold, they came back with well, that's fine. Hey, how about we have you do computers instead of math on one condition? You won't go out and pursue your master's degree because we don't want you to come back to us and say that you didn't take this, right? Yeah. It made me write a letter, which I found out is very much illegal and against the ADA guidelines, but that's a whole nother topic. So they let me out of math. I was so excited. I take this paper down to this person called the math chair in the math department. There's a person that's over all the math departments, and she's a chair, and she sits on this throne. And the reason why I say that is because she really irked me.
Yeah.
I go into her office, I sit down so she can release me from my responsibilities of math. And I don't think she thought it was real.
Yeah.
And she kind of started giving me this lecture about trying hard and doing all this stuff.
Doing more.
And she said to me, I don't really know what your problem is because we've taught blind people to do math.
Totally different disability and limitations.
Like I get kind of emotional thinking about it. I was like, that was the most
such a stab
heinous thing I've ever heard from an adult. Like, do you really think I'm making this up? I went through all this. I paid all this money. I did all this time.
Let alone just even the understanding that like this is a limitation and this is an issue.
Herself. Yeah. So pissed. And I'm like, and it hit me right then too. I'm like, this is how people feel when they're stigmatized. This is it. I remember telling you, it felt like someone was calling me a drug addict again. Like all this stuff. Mm-hmm. I've taught blind people to do math. That's fantastic, you witch. I'm not blind. Yeah. I can't do this.
Something else.
Yeah. And so, long story short, did all the classes, finished, and then immediately went and got my master's degree.
Went and applied for a school that was going to have some different entrances without math and got his master's.
So, I look at that and I'm thinking, geez, man, that stigma really does hurt. It really does suck. And so,
well, and again, not only other people, but like, what did it do to you as you started to have some hope and some glimmer that something could be different for you? And then it's like she knocks you right down again.
Oh, yeah.
And
it sucked, man, because I really did think that they thought I was trying to pull the wool over their eyes. Mm-hmm. And,
and then you start questioning yourself. I am dumb. I can't do this.
All those
why even try
that were put on me as a kid. Yeah, absolutely. Mm-hmm. Like the kid who moved. I moved like, what did I say? Like
25 times?
26 times before I was 18.
18 years?
Never started and finished the school in the same place. So I'm like, come on. Like, yeah, there's issues there.
Yeah.
So, oh my gosh, it pissed me off so bad. But then you look at this and you think, okay, so am I a math learning disability? No, I have it. Mm-hmm. I find a way to work with it. Yeah. Absolutely.
If we know those things and we're aware of those things, we find other support, other resources to help to make the person stronger and give, preventative factors for youth as they're growing up. Like some of these kids that are growing up because they've lost their parents. We need more services to help strengthen them and help them, be safer to be able to fight that substance misuse.
100%. So, it's an interesting topic. It's a little bit challenging to deliver, but I think that it's going to maybe help spark the conversation so that eventually we'll be able to redefine the way that not only we discuss these critical issues, but we also maybe render aid in a different sense, in a different light.
Let's start using better terms, using person's first language. Let's focus on the person, not the behavior.
Yeah, absolutely. So, everybody, thanks for all that you're doing. Again, if you want to be part of the solution, jump on addict2athlete.org. You'll find all kinds of information there, Backlog Podcast, our team store, information about the team, our recovery coach program, everything you need, addict2athlete.org. Continue to look at the calendar on there. That's where all of our events are coming from. And jump on the podcast. Leave us a review. It helps get the podcast out there a little bit further. As always, do your best to turn that mess into a message.